Top 6 best milks that are safer for people with kidney disease. Check the label before you drink them. Number 1. Rice milk. Rice milk has been around for many years, and it is still one of the most kidney-friendly milk alternatives for many people. One of its biggest advantages is that it is hypoallergenic. That means it is less likely to cause common food allergy problems. Unlike dairy milk, soy milk, or nut-based milk, rice milk is usually free from many common allergens. This can make it a helpful choice for people with food sensitivities. Rice milk is also naturally lactose-free. That means it may be easier to digest for people who are lactose intolerant. But the biggest reason rice milk stands out for kidney disease is its mineral profile. Rice milk is naturally low in potassium. It is also naturally low in phosphorus, and it is low in protein. For many people with chronic kidney disease, this can be useful. When kidneys are not working well, potassium and phosphorus can build up in the blood. Too much potassium can affect the heart. Too much phosphorus can affect the bone's blood vessels and overall health. That is why many kidney patients are told to watch these minerals carefully. Rice milk can be a safer choice because it does not naturally bring high amounts of them. Many other plant-based milks can be trickier. Some almond milks and oat milks may contain hidden phosphorus additives. Some soy milks may be higher in potassium. Some fortified milks may contain minerals that are not ideal for every kidney patient. Rice milk is usually simpler, but there is one important warning. You must watch out for additives. Some brands add phosphate preservatives. These additives may improve texture. They may help the milk last longer on the shelf, but they can be a problem for kidney health. Phosphorus additives are absorbed by the body much more easily than natural phosphorus in whole foods. That means even a small amount can matter. So when you choose rice milk, do not only look at the front label. Turn the carton around. Read the ingredient list. Avoid words that contain phytos. This includes phosphate, phosphoric acid, tricalcium phosphate, and similar ingredients. Another thing to watch is added sugar. Some rice milk brands add sugar to improve the taste. But too much sugar is not good for anyone. It can be especially concerning if you have kidney disease, diabetes, insulin resistance, or high blood sugar. That is why unsweetened rice milk is usually the better choice. Rice milk also has a light and smooth texture. It is easy to drink on its own. It can also be used in cereal, smoothies, oatmeal, or coffee. Because rice milk is naturally higher in carbohydrates, it can provide energy. That may help some people who are losing weight or struggling with appetite. But remember this, rice milk is low in protein. That can be good for some people with early-stage kidney disease, but it may not be enough for someone who needs more protein. People on dialysis often need a higher protein intake, so your needs may be different from someone else's. That is why it is always best to ask your doctor or renal dietitian what is right for you. Overall, rice milk is one of the gentler milk alternatives for kidney health. It is easy to digest. It is free from many common allergens. It is usually low in potassium and phosphorus. Just choose an unsweetened version and avoid phosphate additives. Number 2. Soy milk. Soy milk is one of the most popular dairy-free milk alternatives. It has been used for a long time, and it is one of the most nutritionally balanced plant-based milks. But for kidney health, soy milk requires more careful attention than rice milk. The main thing to watch is potassium and phosphorus. Soy milk can vary a lot depending on the brand. Some brands may be moderate in potassium. Others may be too high for someone who needs strict potassium control. The same is true for phosphorus. Some soy milk products contain phosphorus naturally. Others may also contain phosphorus-based additives. That is why soy milk is not a one-size-fits-all choice. For some kidney patients, soy milk may be fine. For others, it may not be the best option. The key difference is your lab results. If your potassium is normal, your dietitian may allow a moderate amount. If your potassium is high, you may need to choose a lower potassium milk. The same applies to phosphorus. If your phosphorus levels are high, soy milk with additives may not be safe. What makes soy milk stand out is its protein content. Soy milk usually contains much more protein than rice milk, almond milk, coconut milk, or cashew milk. In fact, it can have a protein level closer to cow's milk. This can be helpful for people who need more protein. For example, many people on dialysis need higher protein intake. Dialysis can remove some protein from the body, and not eating enough protein may lead to muscle loss, weakness, and poor nutrition. For these people, soy milk may be useful. Soy milk may also be helpful for some people with diabetes. Protein can help slow digestion. It may support steadier blood sugar when used as part of a balanced meal, but again, this depends on your personal health needs. If you are in an earlier stage of chronic kidney disease, you may be told to limit protein. In that case, soy milk may not be the best daily choice. Another benefit of plain soy milk is that it is usually low in oxalates. This matters for people who have a history of certain kidney stones. Some foods and drinks are high in oxalates. Oxalates can bind with calcium in urine. This may contribute to calcium oxalate stones in people who are prone to them. Soy milk is usually much lower in oxalates than many whole nuts. That may make it a better option than almond milk for some people with kidney stone concerns, but not all soy milks are equal. Some contain added sugar, some contain phosphate additives, some are heavily fortified with minerals, some have long ingredient lists. For kidney health, plain and unsweetened is usually the best direction. Choose a soy milk without phosphorus additives. Look for a simple ingredient list and compare potassium and phosphorus levels on the nutrition label. Also, watch for calcium fortification. Calcium is important for the body, but some people with kidney disease need to monitor calcium intake. This is especially true if they have a history of calcium-based kidney stones. It may also matter if they take phosphate binders. So if you are unsure, ask your renal dietitian. Soy milk can be a great choice for many people with kidney disease. It is especially useful for those who need more protein, but it must be chosen carefully. Check the brand, check the minerals, check the additives, and choose unsweetened whenever possible. Number 3. Almond milk. Almond milk is one of the most common dairy-free milks in America. Many people choose it because it is light, smooth, and easy to find. But is almond milk a good choice for kidney disease? For many people, the answer is yes. But there are a few important warnings. Almond milk is naturally low in potassium. It is also usually low in phosphorus. That makes it a helpful option for many people who need to manage these minerals. When kidneys are not filtering well, potassium and phosphorus can become difficult to control. So choosing a milk that is naturally lower in these minerals can reduce the burden on your diet. Almond milk is also low in protein. For people in earlier stages of chronic kidney disease, this may be useful. Some people with CKD are told to avoid too much protein. Too much protein can increase waste products in the blood. It may also make the kidneys work harder. So a low-protein milk alternative can fit well into a lower-protein eating plan. But this is not true for everyone. If you are on dialysis, your protein needs may be higher. In that case, almond milk may not provide enough protein. That does not mean you cannot drink it. It just means you may need to get protein from other foods. The biggest issue with almond milk is not always the almonds. It is often the additives. Many commercial almond milks contain phosphorus additives. These additives help improve texture. They may also improve shelf life. Some brands add them during fortification. But for kidney patients, they can be risky. Phosphorus additives are absorbed very easily by the body. That means they may raise phosphorus levels more quickly than natural phosphorus from whole foods. So always check the ingredient list. Avoid ingredients with phosphorus in the name. Almond milk can also be fortified with calcium. Some brands contain a lot of added calcium per serving. Calcium is not automatically bad, but some people with kidney disease need to be careful with calcium. This is especially true for people with kidney stones. It may also matter for people with mineral imbalance or those using certain medications. If your doctor told you to limit calcium, choose an unfortified option when possible. Now let's talk about oxalates. Whole almonds are high in oxalates. Oxalates can contribute to calcium oxalate kidney stones in people who are prone to them. Almond milk usually contains far fewer almonds than a serving of whole almonds, so the oxalate level is often much lower than eating a handful of almonds. But if you have a strong history of kidney stones, especially calcium oxalate stones, you should be cautious. For those people, rice milk or flax milk may be a safer choice. Almond milk is best when it is unsweetened. Sweetened almond milk can contain added sugar. Vanilla versions may also contain sugar unless the label says unsweetened. Added sugar can be a problem for blood sugar control. It can also add empty calories without giving much nutrition. For kidney health, choose unsweetened almond milk. Look for no phosphate additives. Look for a simple ingredient list and check the potassium, phosphorus and calcium amounts. Almond milk can work well in cereal. It can be added to smoothies. It can be used in coffee. It can also be used in oatmeal or baking. It has a mild flavor that many people enjoy. In summary, almond milk can be a good kidney-friendly milk alternative. It is usually low in potassium. It is usually low in phosphorus. It is low in protein. But the brand matters. Avoid phosphate additives. Be careful with added calcium. And talk to your dietitian if you have a history of kidney stones. Number 4. Coconut milk. Coconut milk can be confusing. That is because there are two very different types. The first type is canned coconut milk. The second type is coconut milk beverage. They are not the same, and for kidney disease, the difference matters. Canned coconut milk is thick and creamy. It is made from coconut blended with a small amount of water. Because it is concentrated, it can be higher in potassium. It is also high in fat. That makes it rich and flavorful. But it may not be something you want to drink by the cup. For people who need to limit potassium, canned coconut milk should usually be used in small amounts. A little can add flavor to soups, sauces, curries, or desserts. But drinking large amounts may not be the best choice. Coconut milk beverage is different. It is much more diluted with water. It is made to be used more like regular milk. It is thinner, it is lighter, and it usually has much lower potassium than canned coconut milk. For people with kidney disease, coconut milk beverage may be the safer choice, but again you must read the label. Some coconut milk beverages contain phosphorus additives, some contain thickeners, some contain sweeteners, some are fortified with minerals. These additions may not be ideal for every kidney patient. One benefit of coconut milk is that it is naturally low in sugar when it is unsweetened. It is also naturally higher in fat than many other plant-based milks. For people following a lower-carb diet, this may be helpful, but if you have heart disease, high cholesterol, or need to watch saturated fat, ask your healthcare provider how much coconut milk is appropriate. Coconut milk is also low in oxalates. This is important. Unlike almond milk, which comes from a high oxalate food, coconut milk is usually much lower in oxalates. This may make it a better option for people who are prone to calcium oxalate kidney stones. It may also be worth considering for people with polycystic kidney disease or a history of stone problems. But low oxalate does not mean unlimited. You still need to check potassium, phosphorus, sugar, and fat. The best coconut milk choice for kidney health is usually an unsweetened coconut milk beverage, not canned coconut milk, not sweetened coconut milk, not coconut cream. Look for a product without phosphate additives. Choose one with a simple ingredient list. And compare potassium levels between brands. Coconut milk beverage has a mild flavor. It works well in cereal. It can be added to smoothies. It can be used in coffee. It can also add a light coconut taste to recipes. Some people love the flavor. Others may prefer a more neutral milk. That is a personal choice. For kidney disease, the main rule is simple. Know which type you are using. Canned coconut milk is rich and concentrated. Coconut milk beverage is lighter and usually more kidney-friendly. Use canned coconut milk in small amounts. Choose unsweetened coconut milk beverage for everyday use and avoid phosphate additives whenever possible. Number 5. Oat milk. Oat milk has become one of the most popular dairy-free milks. Many people love it because it is creamy. It feels closer to dairy milk than many other plant-based options. It works well in coffee. It works well in cereal. It works well in smoothies. And it has a smooth texture that many people enjoy. Oat milk is also allergy-friendly for many people. It does not contain nuts. It does not contain soy. And most people who avoid dairy can tolerate it. But for kidney disease, oat milk needs careful attention. It is not always the safest choice. The first thing to watch is carbohydrates. Oat milk is often higher in carbohydrates than almond milk, coconut milk, or cashew milk. This may matter if you have diabetes. It may also matter if you are trying to manage blood sugar. Some oat milks contain added sugar. Others may not have added sugar, but still contain natural carbohydrates from oats. So if blood sugar is a concern, check the nutrition label carefully. Choose unsweetened oat milk whenever possible. The second thing to watch is protein. Oat milk usually contains more protein than some other plant-based milks, but it is still not as high in protein as soy milk. For some kidney patients, this protein amount may be fine. For others, it may need to be counted. If you are in an earlier stage of CKD and following a lower protein diet, ask your dietitian how oat milk fits into your plan. If you are on dialysis, oat milk may not provide enough protein by itself, so your total diet matters. The third thing to watch is potassium. Potassium in oat milk can vary widely by brand. Some oat milks are fairly low, others may be higher than expected. This is why you cannot assume all oat milk is kidney-friendly. You must check each label. If your potassium is normal, your dietitian may allow it. If your potassium is high, you may need a lower potassium milk. The fourth thing to watch is phosphorus. Many oat milk brands contain phosphorus additives. This is one of the biggest concerns. These additives are often used to improve texture. They may also be used to improve shelf life, but for kidney patients, they can be harmful over time. Phosphorus additives are absorbed easily. They may raise phosphorus levels in the blood. High phosphorus can affect bones. It can affect blood vessels. It can also increase the burden on your kidneys. So when you choose oat milk, read the ingredient list. Avoid ingredients that contain PHOs. If you see phosphate phosphoric acid or calcium phosphate, choose another product. Another thing to consider is calcium fortification. Many oat milks are fortified with calcium. For some people that may be helpful. For others, it may not be ideal. The problem is that many calcium-fortified oat milks also contain phosphorus additives. That can make it harder to find a clean option. Oat milk can still be part of a kidney-friendly diet, but it depends heavily on the brand. Choose unsweetened. Avoid phosphate additives. Check potassium. Check carbohydrates. And ask your dietitian if you are unsure. Oat milk is best for people who want a creamy dairy-free option. It may be especially useful for people who cannot tolerate nuts or soy, but it is not automatically safe just because it is plant-based. With kidney disease, the label matters more than the marketing. Number 6. Cashew milk. Cashew milk is another plant-based milk option. It is not as famous as almond milk or oat milk, but it can be a good choice for some people with kidney disease. Cashew milk has a rich and creamy texture. It has a mild flavor. It does not usually overpower coffee, cereal, oatmeal, or smoothies. Many people like it because it feels smooth and satisfying. Cashews themselves contain healthy fats. They also contain minerals like magnesium, zinc, copper, and iron. But when cashews are turned into milk, many of these nutrients may be diluted. That means cashew milk is not the same as eating whole cashews. It is usually much lighter. This can be helpful for kidney patients. Whole cashews can be higher in minerals and oxalates. Cashew milk usually contains much less because it is mostly water. For potassium, cashew milk is often relatively low. Many brands contain around 150 milligrams or less per serving. That can make it a reasonable option for people who need to limit potassium. But this can vary, so check the label before buying. Do not assume every brand is the same. Cashew milk is also usually low in protein. This may be useful for people in earlier stages of chronic kidney disease who need to limit protein, but it may not be enough for someone on dialysis who needs more protein. Again, your stage of kidney disease matters, your lab results matter, your overall diet matters. Oxalates are another point to consider. Whole cashews are naturally high in oxalates. That can be a concern for people who are prone to kidney stones. Cashew milk usually contains far less oxalate than whole cashews. But if you have a strong history of calcium oxalate stones, you should still be careful. Ask your renal dietitian whether cashew milk is a good fit for you. The biggest warning with cashew milk is the same warning we keep coming back to: phosphorus additives. Many plant-based milks contain added phosphates. These additives are not ideal for kidney disease. They are absorbed easily by the body, and they can raise phosphorus levels over time, so read the ingredient list. Look for simple ingredients. Avoid phosphate additives. Choose unsweetened whenever possible. Cashew milk can be a nice option if you want something creamy. It can be used in coffee. It can be used in smoothies. It can be poured over cereal. It can also work in recipes that need a mild dairy-free milk. But because there are fewer cashew milk options on the market, you may need to compare brands carefully. A clean cashew milk should have minimal ingredients. It should not contain added sugar. It should not contain phosphorus additives. And it should have a potassium level that fits your diet. For many people with kidney disease, cashew milk can be a good choice in moderation. It is creamy. It is usually low in potassium. It is usually low in protein, but it is not perfect for everyone. If kidney stones are a concern, be cautious. If protein needs are higher, it may not be enough. If the brand contains phosphate additives, choose another option. So there you have it, 6 milk options that may fit into a kidney-friendly diet: rice milk, soy milk, almond milk, coconut milk beverage, oat milk, and cashew milk. Each one has benefits. Each one also has things to watch out for. Rice milk is one of the safest choices for many people. It is low in potassium, it is low in phosphorus, it is low in protein. It is also allergy-friendly, but it should be unsweetened and free from phosphate additives. Soy milk is higher in protein. That may be helpful for people on dialysis. It may also support nutrition for people who need more protein, but it can be higher in potassium and phosphorus, so the brand matters. Almond milk is usually low in potassium and phosphorus. It is also low in protein. That can be useful for early-stage CKD, but it may not be ideal for people with a history of kidney stones. It may also contain added calcium or phosphate additives. Coconut milk beverage can be a good option. It is usually lower in potassium than canned coconut milk. It is also low in oxalates, but choose the beverage version, not the concentrated canned version for daily drinking, and avoid added sugar or phosphate additives. Oat milk is creamy and popular. It is a good option for people who avoid nuts and soy, but it can be higher in carbohydrates. It may affect blood sugar. It may also contain potassium or phosphorus additives, depending on the brand. Cashew milk is creamy and mild. It is often lower in potassium. It can be a good dairy-free option, but people with kidney stone concerns should be cautious, and everyone should check for phosphate additives. The most important lesson is this: do not choose milk based only on the front of the carton. Words like natural, plant-based, organic, or dairy-free do not automatically mean kidney-friendly. You need to check the nutrition label. Look at potassium, look at phosphorus, look at protein, look at sugar, and read the ingredient list. Avoid phosphate additives whenever possible. A helpful trick is to look for ingredients with phos in the name if you see that the product may not be the best choice for kidney disease. Also remember that kidney diets are personal. One person may need more protein, another person may need less. One person may need to limit potassium, another person may not. One person may need to watch phosphorus closely. Another person may need to focus more on blood sugar. That is why your lab results matter. Your stage of kidney disease matters, your medications matter, and your overall eating pattern matters. So before making a major change, talk with your doctor or renal dietitian. They can help you choose the milk that fits your body. Small changes can make a big difference. Switching from the wrong milk to a better option may help you manage potassium, phosphorus, sugar, and protein more carefully. It may also make your kidney-friendly diet easier to follow. The goal is not to fear every food. The goal is to choose smarter, read the label, choose unsweetened, avoid phosphate additives, and pick the milk that matches your health needs. If this video helped you, please like and subscribe to Health Tips 60+, and tell us in the comments, which milk do you use most often? Rice milk, soy milk, almond milk, coconut milk, oat milk, or cashew milk? Your answer may help another senior make a smarter choice too. Thank you for watching. Take care of your kidneys, and we will see you in the next video.